Leadership Academy Foundations of Medical Education video series. What are some of the challenges you faced as a new faculty member, and how did you overcome them?
Some of the barriers, I think, are perceptions. I think when folks are looking at a faculty role, some of the first thoughts that come to mind are, am I qualified enough? Do I have enough experience? Am I going to be a good teacher? What could I possibly teach, someone who's new to medicine? But I think that those feelings are very normal. And I even remember having mentors tell me that just for clinical practice alone, it takes a good 5 years at least into practice before you feel like you know what you're doing. I would say just kind of telling yourself that and talking to other faculty members who have been new before, and kind of seeing what they felt like when they were starting. Two, remembering that if you've graduated from, a solid residency program, you have had good training, and you are actually very up to date on what the current guidelines and recommendations for patient care are, and that puts you in a great position to be teaching new residents. The other is that there is always support out there, and so if you don't feel like your teaching skills are up to speed, there are fantastic national programs, national conferences from STFM to AFP RLS to ACGME, and then lots of local and regional conferences. I know for me, when I first started, I was part of the University of Vermont's Health Network, and they had something called the Teaching Academy, and that was great to get a foundational experience. So I really encourage people to find ways to kind of get that foundational teaching in teaching, and just kind of approach it with humility, knowing that you're going to make mistakes, but you also have a lot to bring to the table. And if you have that kind of humble mindset, learners really appreciate that as well.
Honestly, just looking back, I really can't think of anything because it's really not that difficult. And I think probably the most annoying part of it, and I think it's just part of, just what is required, is filling out surveys, or filling out the ratings of students and things like that. And I think that can be made better if you kind of clarify what the expectations are for, a resident in this certain level, of training and such.
I think one of the challenges that I was faced was the concern that teaching was going to take away from my time in clinical practice and building kind of that foundation of my beginning years in my career and take away from my opportunities to learn. However, I've actually found that my learning has almost been accelerated in a way because as I'm supervising residents, I'm getting more opportunities to see more patients all at once. And also it frees up my mind a little bit to not feel as bogged down by all maybe like the clerical or footwork of things, but think about the higher level concepts that are important. And so really it's been an opportunity for me to accelerate my learning in a way.
Leadership Academy Foundations of Medical Education video series.